Hi, I'm Sophia and welcome to WKU News. Tonight we're going to be interviewing the owners and some of the facility's nurses and doctors from Rolling Hills. Hi, I'm Sophia and I'm here with the co-owners of Rolling Hills Care Center. This is Olivia and this is Hallie. Hey guys, thanks for having me.
Thanks for having us, Sophia. We are so excited and proud about the future of Rolling Hills Care Center. Our care center is not just a place where kids can come for treatment, but it is also aiming to reach out to the community to prevent these mental health issues in the first place. Our facility will aim to treat mental disorders such as depression and anxiety, particularly among adolescents.
So one of your focuses is going to be lowering these feelings of anxiety and reducing the symptoms of depression in hopes to decrease adolescents' suicide attempts. Is that right?
Yes, so stated originally from the American Foundation for Suicide Prevention, suicide is the 10th leading cause of death in the U.S., with an estimated 45,000 people died each year due to suicide. That same site also states that Kentucky's suicide rate in 2016 was 3 times the U.S. national average. The stigma around suicides has got to end. There has to be a greater discussion, and what brings people to end their own life, and we need to change the stigma around it, and we can do better and bring more attention to it through our facility.
So this is what Rolling Hills Care Center will focus on. We're having tough conversations with those who have even attempted or even considered having suicidal thoughts or actions, so we can best understand what they're feeling and why they're feeling like ending their life is their only option. Once we can understand their thought process, we can use our team of professional nurses and doctors with expertise in mental health to offer better treatment plans for them.
So what are your plans to help spread awareness and get a good reach out to your community?
So we have arranged to visit local schools ranging from elementary to high school. For our high schools, we're thinking more along the lines of organizing men and women who have a history of mental disorders, some of those who have maybe experienced suicidal thoughts or actions, or maybe have just had the effects of someone else experiencing that in their lives, to come into the schools and have conversations with students. In our elementary schools, we will have doctors and other medical professionals come and talk to the students in smaller settings, so it's more one-on-one impact about the effects of depression and how they can find happier solutions in their lives.
In these community outreach programs, faculty of Rolling Hills will be there to make the students aware that we are providing an opportunity to seek help and introduce them to programs we offer, such as our counseling sessions, both groups and private, our fundraising events such as our prevention 5K walk, and also our personal favorite, a lock-in movie night where kids can come and meet other kids who are experiencing the same emotions as they are.
Nurse Grace is here today to discuss how she has seen the effects of lack of treatment in her past 10 years working for a regional hospital and how she plans to improve these at our new facility.
According to the Washington Post, the United States spends $113 billion on mental health treatment. Mental health dollars go towards prescription drugs and outpatient treatment. Also mentioned in the article, it is harder to access mental health care professionals because there is a shortage.
Nurse Thorne and Dr. Ford are discussing the symptoms of depression and disorders and how this relates to their everyday job in the hospital.
The facility was created to provide easier access to physicians and screening tools for adolescents with mental health disorders because there is a shortage. Treatment will be offered in hopes to improve children's lives and ultimately reduce suicide rates by combating various mental illnesses.
Well, we come to realize or to recognize symptoms usually common in human beings that are experiencing mental disorders. Symptoms are suicidal thoughts, prolonged depression that relate to sadness and irritability, substance and use, etc. As a nurse, we qualify with little training in mental health, and it was also very common for me to see as the physical signals of depression, such as cutting. There are many times where when I, as a nurse, plays a virtual role as a psychiatric care process.
The Rolling Hills Care Center plans to open in the next few weeks, so keep your eyes and ears open. If you wish to donate or have any questions about the facility, you can go to www.rollinghills.com. That's all I have for tonight. Thank you for watching WKU News.